spring in western New York. Folks, it's a great look Monday, and I think we'd all agree that how our mouths look is a great part in our overall appearance. Thanks to Dr. Todd Shatkin and Aesthetic Associates, we have something here that shows just what they can do for you to make your mouth look its best. Then we'll talk with Dr. Shatkin on the other side. Let's take a look.
New advances in dentistry are yielding much more than efficient dental health results. Today's dental implants give the aesthetics, function, and feel of natural teeth. And for patients, that life-changing smile is more accessible and affordable than ever to achieve.
Up until recently, it would require patients to go to the dental office multiple times, sometimes 7 or 8 times, to replace a single tooth or to stabilize a denture, and it would normally take 9 to 12 months to complete this process, oftentimes requiring multiple surgeries. The trouble with the larger implants in many cases is patients have to undergo a lot of surgery to make room in the bone for these larger implants, oftentimes requiring a sinus lift procedure where they actually lift the sinus up, put bone graft material into the sinus, and that requires another 3 to 4 months of healing before they can go back and do the surgery to place the implant. This requires a lot of healing, it's invasive, and it's time consuming for the patient, and it's very costly.
With over 20 years of experience with implant dentistry, Dr. Todd Shatkin helps his patients achieve that perfect smile. Using mini dental implants, Dr. Shatkin developed a revolutionary patented technique that replaces a single tooth, multiple teeth, and even all teeth in 2 appointments in a non-surgical procedure.
The great thing about mini implants is we can place them and use them immediately, because they're threaded into the bone much like a screw would be threaded into a piece of wood. We don't remove a lot of bone to place these mini implants. We make a small pilot hole and we go through the soft tissue into the bone. It's minimally invasive. It does not require cutting of the gum tissue or sutures or stitches or anything like that. It's a non-surgical technique, placing the implant through the soft tissue and into the bone, and we can either anchor a denture onto it immediately or a single or multiple teeth.
This combination of technology and innovation was created in response to the tremendous patient demand and need for dentistry to have procedures that are less invasive, less time-consuming, and less costly for the patient, with less discomfort and quicker recovery time.
I had a space in the back of my mouth. As a child, I had a bad root canal, and unfortunately, I had the tooth extracted. So growing up, I had no confidence. I never wanted to smile. So when I met Dr. Shatkin, he told me about his mini dental implant. It was almost too good to be true. I couldn't believe that you could walk into his office, have a procedure done, quick and painless, and then walk out with the tooth. I haven't had one problem with it. I floss it just like every other tooth. I would highly recommend Dr. Shatkin to any of my friends or family. I now have the confidence to show the world my smile.
Since 2000, Dr. Shatkin has placed over 10,000 mini dental implants with a success rate of over 95%. Dr. Shatkin is making these inventive techniques available for patients everywhere by teaching it to dentists from all over the country, all of whom have been able to replicate his success rates.
When I discovered this procedure and I started doing more of them and having 98% success with them, I knew it was time to get that message out to dentists everywhere so that they could offer those procedures to their patients. Dentists around the country send their cases here to Buffalo, to my office, and I personally review all those cases for them and work closely with them on every case that they do. And we fabricate surgical guide stents and restorations for them so that they can go ahead and use my technique in their patients' mouths in their offices, and I'm guiding them along the way.
I didn't like my smile because my gum showed when I would smile, and I wanted my smile back like I had when I was a younger person. I had my procedure a few months ago, and Dr. Shatkin recommended that I have implants, and it went great. No problem. I love them. I truly thought that it would be very, very painful, and I was amazed that it only took a little over an hour, and when I went home, I could basically eat everything again. Everyone notices, you know, that I smile more, and my confidence is better now than it ever has been, and they're amazed how, you know, how it changed my whole life. If you're thinking of having implants done, I would suggest talk to Dr. Shatkin about it, and he'll explain everything to you. I couldn't be more satisfied with the way he treated me. I mean, I said this before, if I didn't love my husband, I surely would love Dr. Shatkin.
One of the things I'm most proud of is the research that I did on mini dental implants dating back about 8 years ago. We started doing some research studies, and these studies were actually used to get the acceptance by the FDA for mini dental implants to be used in patients' mouths long term. So many millions of Americans suffer from loose dentures or ill-fitting dentures. The mini dental implants can be used to stabilize those loose dentures, and in less than an hour and a half to 2 hours we can stabilize both the upper and lower denture, and we can completely remove the palate from the roof of the mouth, the acrylic on the denture, so that they can now feel the roof of their mouth, they can taste the foods better, they feel hot and cold liquids, so it's a much more natural feel. And these patients can go out and they can speak in public and not worry about those teeth moving around. I feel like I've had a major impact in dentistry, and I enjoy when I hear from a doctor who's got satisfied patients and they've had these teeth replaced in 1 or 2 visits, or they've stabilized a loose denture, which was really making it very difficult for them to function in their daily lives, and now they can go out and they're very happy. And I hear this every day from the dentists that I've taught. Through my training and through our Shatkin First Laboratory, we've built a network of dentists out there throughout the country who are there to help you. And we will help you find those dentists so that you will be very comfortable knowing that those dentists are properly trained and they're certified on my mini dental implant procedures.
You can have your mouth quickly, affordably, and comfortably restored. Learn more about Dr. Shatkin's mini dental implants and patented techniques today, and get the smile you've always wanted. To find a dentist in your area trained in Dr. Shatkin's implant techniques, visit shatkinfirst.com or call 1-866-GET-MINIS.
All right, folks, so I got to tell you something. What we just saw not that many years ago was pure science fiction. We can be very proud of Dr. Shatkin and Aesthetic Associates. We're going to take a break, and then we'll come back and talk with the doctor himself. Please stay with us. Good morning and welcome back to the program. Well, if you were just with us a few minutes ago, you saw an amazing video of the advancements that have been made in dentistry. And the advancements we saw on that video originated right here in Western New York with our guest seated right here beside me, Dr. Todd Shatkin. Doctor, thanks for being with us this morning.
Thanks, John.
That was just amazing.
Thank you.
Just absolutely amazing. And we want to let folks know that if you have any questions for the doctor, we'll gladly take your calls at 644-9840. And especially if you were impressed by that video and you want problems like that corrected. You invented or perfected that system right here.
Yeah, I have a patent on the mini implant procedure to replace individual teeth, and that's pretty much a big part of what I do on a daily basis, is replace 1 or more missing teeth for patients who have lost teeth due to either decay, periodontal disease, or trauma in their lifestyle.
An accident or something?
Could be any reason,
right.
You know, and so we can replace those teeth very easily and usually in 1 or 2 visits.
That is amazing. What was before the mini implant? What had to be done to put the teeth in that way?
That's a great question, and I didn't even prompt you on that question.
No, you did not.
That's a very good question, because we used to have to use larger implants, and the larger implants are 2 to 3 times in the size and diameter of the mini implants. And with those procedures, you had to make an opening in the gum, take out make some drill holes into the bone to remove the bone that was there to make a hole big enough to fit this large implant in. And then we would suture the gum up and let it heal for anywhere from 4 to 9 months. And after that period of time, you go back into the office, open the gum up again, uncover that implant that we put in 4 to 9 months earlier, screw a top on it, and then suture the tissue back and let it heal for a few weeks, and then have you back and take impressions and make the restoration.
So you're talking close to a year in the old system.
It can be 6 months to a year before it's all finished.
We have a call from Niagara Falls this morning. Good morning. Welcome to the show.
Good morning.
Hi.
Hi. I have a question for Dr. Shatkin.
Yes.
I'd like to know why when a person gets dentures, I had to get them at the age of 52, why the whole face seems to drop.
Okay, well, that's a great question. What happens is, if the dentures are made properly from the beginning, the face should be supported by the acrylic and by the teeth. But what happens is, over time, as you wear the dentures, your gums and your bones shrink. And so as the gums and bone shrinks, the dentures settle. And they settle in and they push up or down, as the case may be, and you end up looking older because your lips and your mouth, you lose that support. So it's important that when you get dentures, number one, to have them made properly. Number two, you need to go back to the dentist on a regular basis to make sure those dentures are relined or fitted over about once every year or two to be built back up as your bone shrinks. But the advantage of doing implants, or especially the mini implants, is they can usually be done right away at the time you take the teeth out and give you the dentures. We can put the implants in, and those actually preserve the bone and the gum tissue so you don't get that shrinkage.
Boy, she came up with a question I wasn't aware of. I didn't know the face sags, or...
Well, you know what happens, you look at old people and the tip of their nose and their chin are getting closer and closer together.
Yeah.
Because they're losing that bone support, and they got bigger wrinkles at the corner of their mouth. They're all settled in. And if the dentures are made properly, you can open that vertical dimension back up, give them a more youthful smile, and then support those dentures with implants.
Okay, Michelle, your time is up here. Good morning and welcome to the show.
Oh, yes, hello.
Hi.
Hi. I have a 12-year-old daughter, and she is missing 3 permanent teeth. And it's been suggested to us that she can either have the teeth removed, I guess, close her spaces now, or keep her baby teeth, because they may last into her 30s and 40s. They may not. That's what we're not sure of.
You said she's 12?
She's 12 now, and so we have decided to keep her teeth, the baby teeth, and just sort of see what happens as time goes on, and hope that there are better ways to implant teeth, which I've just seen that there may be.
Yes.
What would be your suggestion for that?
Yes, I think you're doing the right thing, Michelle. I would leave the baby teeth in there for now, preserve that space, get the teeth straightened around it if she needs braces. I'm not sure without looking at her, but preserve that space for the time being, because we can take those teeth out later at maybe 16, 17 years old and place the mini implants in at that time, and you won't lose that space. If you take the teeth out and they move the other teeth into that space, then you're collapsing the dental arch and you lose the fullness of that smile that you want to achieve when she's a teenager.
I never thought to ask at what age do you recommend you start with the mini implants?
We've done them as young as 14 or 15 years of age, but usually 16 to 17 if you have congenitally missing teeth like Michelle's daughter does.
Right. Doctor, I don't know if we have time for you to tell us all the countries you've been to, but you have done extensive traveling, presenting this procedure in seminars and lectures.
I have. I've been lecturing all around the world. I've been to England, I've been to Mexico, I've been to South America, Canada, of course, Australia, New Zealand, Asia. What countries would you say are up to speed now with this procedure? Well, most of the countries that I've trained are doing the mini implants. I've trained over 9,000 dentists throughout the world over the last 11 years or so on the procedures, and it's really becoming a very, really state-of-the-art kind of an accepted procedure. FDA's accepted it, but I'm getting tired of traveling, to be honest. And so I built a training center right here in Buffalo, and I bring dentists to Buffalo once a month, and I train them.
That's super. That is absolutely super. Doctor, thank you for being with us this morning.
Thank you.
It's been a very impressive presentation.
Thanks very much.
Very much. Folks, Aesthetic Associates Center is there for you at 2500 Kensington Avenue in Amherst, and you can give them a call at 839-1700 or go online to the website right there, gr8look.com.